Are you one of the millions struggling with constant pain, fatigue, and frustration of fibromyalgia? If you've ever wondered whether myofascial release could be your answer, you're not alone. Today, we're diving deep into what science really says about this popular treatment option, and the answer might surprise you. I'm Dr. Michael Lenz, and this evidence based exploration will cut through the confusion about myofascial release therapy for fibromyalgia. We'll examine the latest research, break down what actually works, and help you make informed decisions about your treatment journey. Whether you're considering this therapy or just wanting to understand your options better, this video is for you. Before we dive into the research, let's understand what myofascial release therapy actually is. It's a specialized form of manual therapy that focuses on treating the fascia, the connective tissue that surrounds and supports your muscles throughout your body. During treatment and specific stretching techniques to areas of tightness or pain. The goal is to improve mobility and reduce discomfort by releasing restrictions in this important tissue network. Understanding how myofascial release might help fibromyalgia requires examining two different perspectives. One theory suggests that manual pressure and stretching can release restrictions in fascia that develop from injury or stress. However, modern research has revealed fibromyalgia to be primarily a central nervous system disorder where the brain and spinal cord process pain and other sensations differently. This fundamental distinction is crucial for evaluating the potential benefits of any treatment approach. Research has revealed that people with fibromyalgia experience fundamental differences in how their central nervous system processes information. Studies consistently show these individuals have significantly lower pain thresholds and heightened sensitivity to various stimuli, a condition known as central sensitization. This neurologic difference extends beyond pain. Up to 90% of patients experience severe fatigue, unrelieved by rest, and 70 to 80% struggle with persistent sleep disorders, particularly in maintaining deep restorative sleep. And many have difficulty falling asleep as well. In addition, the majority also have brain fog or cognitive struggles such as focusing and concentration difficulties, as well as short-term memory problems. These aren't just symptoms, they represent core features of how fibromyalgia affects the brain's processing of sensory information and regulation of bodily functions. When we look at research evidence for myofascial release therapy in fibromyalgia, the picture is more complex and varied, with overall quality of evidence being limited. While some studies show improvements in pain reduction and quality of life, these results are notably inconsistent across different research. Interestingly, osteopathic treatment and other manual therapies sometimes demonstrate stronger evidence for symptom management. The optimal treatment frequency and duration aren't well established by current research. It's also worth noting that while myofascial release is generally safe with no serious side effects, we need larger, more rigorous studies to fully understand its role, particularly given that it primarily targets peripheral tissues rather than the central nervous system differences underlying fibromyalgia. A critical aspect often overlooked is the high comorbidity rate with other conditions. Research shows remarkably high rates of ADHD and sleep disorders among fibromyalgia patients, with studies indicating up to 80% of individuals with chronic pain syndromes also having ADHD. This extends to various sleep disorders as well, highlighting the need for comprehensive care. What's particularly noteworthy is that addressing these co-occurring conditions has shown remarkable results, not only improving specific symptoms, but often providing significant relief from overall pain syndromes. This emerging evidence strongly reinforces the importance of a holistic treatment approach that addresses all aspects of the condition. Let me wrap up what we've covered so far. We've explored the complex relationship between myofascial release and fibromyalgia, examining both the theoretical framework and the current scientific evidence. The key takeaway is that while myofascial release targets peripheral tissues, fibromyalgia is fundamentally a central nervous system condition. Current evidence emphasizes the need for individualized, evidence-based treatment approaches. As research continues to evolve, it's clear that we need more comprehensive studies to better understand the most effective treatment strategies for each individual. It's also important to recognize that treatment of fibromyalgia and other nociplastic pain syndromes like migraines, irritable bowel syndrome, chronic back pain, chronic neck pain, chronic fatigue syndrome, chronic pelvic pain, and TMJ involves a biopsychosocial, spiritual, environmental approach. There isn't one silver bullet that typically helps, but all of these treatments combined offer the best results. If you found this information helpful in understanding your condition or treatment options better, please take a moment to like this video and subscribe to our channel. Your support helps us reach more people who might benefit from evidence-based information about fibromyalgia and related conditions. Share your experiences or questions in the comments below. Your insight could help others on their healing journey. Remember, while the path to managing fibromyalgia can be challenging, you're not alone in this journey. Until next time, go Team Fibro.